Oz, who's our emergency operations director, Office of Emergency Management Director. And we've got folks from AMR are going to speak. They're the contract vendor that are helping us administer the vaccine here. We also have a couple other people here to answer questions from the Potter's House as well as the city. So we'll do 3 speakers. And if everyone's ready, we'll go ahead and start with the 60th Mayor of Dallas, Eric Johnson.
Is that my cue?
Yes, it is.
I couldn't hear a word.
Whoa, it's windy out here.
Yeah.
Good morning, everybody. Thanks for being here. If everybody could stay, distance pretty well, I'm gonna take my mask off so you guys can hear me a little bit better. I'll make sure everybody's at a good, safe distance, though. Let me start off this morning by thanking the Potter's House for allowing us to use this incredible space to give out the COVID-19 vaccine. In times of crisis, we need our community institutions and private businesses to step up and to help our city recover and respond. Dallas is our home, and we must all work together to help our city flourish and to keep us safe. During the COVID-19 pandemic that we've all been living through for the past year, the Potter's House and T.D. Jakes Ministries have been a major help to our city, and specifically to my office. I want to say that I appreciate Bishop Jakes' willingness to use his stature in our community to encourage people of color especially to get this vaccine. Too many people still remain hesitant to register for the vaccine, and I'm very happy that Bishop Jakes and others are committed to showing all of our communities that this vaccine is both safe and effective. Every single dose of this vaccine that we give out gets us one step closer to getting back to normal. We've actually made great progress in our city in the fight against COVID-19. FEMA, Dallas County, the city of Dallas, and of course our private health providers collectively are vaccinating tens of thousands of people every week. But with the governor's announcement this week, it's now more important than ever that we get these vaccines out and that we get them out to as many people as we possibly can, as quickly as we possibly can. And this new partnership here at the Potter's House is going to allow us to continue our commitment as a city to helping beat this virus. The opening of this site also marks the beginning of our transition away from the Kay Bailey Hutchison Convention Center hub. The convention center made a lot of sense when we started this vaccination effort because we had vaccinated our first responders there, and it was centrally located. That operation has been running extremely well, and I've been very heartened to receive several messages from people across our city, all over, who've had great experiences receiving their vaccinations at that site. So for now, we're going to continue to give out second doses at the convention center for people who got their first dose there. But it was always our intention to outsource this operation and to locate a vaccination site in the southern part of our city. So I'm thrilled that we're able to set up a vaccination hub at a Southern Dallas institution like the Potter's House and to partner with AMR. We need to continue working to ensure that our underserved communities receive equitable access to this vaccine. But I hope this hub will send a strong signal to all of our communities that this vaccine is for everyone. We're going to get through this pandemic, folks. We're going to get through this. We're getting closer every single day. Vaccines are our single most effective tool for stopping COVID-19, and they will help us achieve herd immunity. However, while we are in the process of pushing people to get vaccinated, you still need to wear your mask. I'm going to issue an order mandating that masks be worn at all city-owned buildings. We have to do what we are legally allowed to do to get people to wear masks. We also need to practice, like we're doing out here today, right now, social distancing. And we still need to avoid taking unnecessary risks. This pandemic is by no means over, and no one can declare it over by fiat. It is incumbent upon all of us to protect the vulnerable in our communities, whatever your risk factors might be. Remember that this isn't just about you. The spread of this virus and its continued mutations put all of us at risk. We lost more than 500,000 people across the country and more than 3,000 people in Dallas County last year. We're in the fourth quarter, so to speak, to use a sports analogy, right now. But we're going to win the game. It's just incumbent upon all of us that we not fumble the ball. We got to continue to wear our masks, and we got to continue to stay on guard. In the next few months, everyone needs to be smart, and they need to be safe. When it's your turn, get vaccinated. Whether it's here or at Fair Park or wherever. I want to say thank you to everyone who helped make this day possible. Thanks to all of you for being here. And now I'm going to turn it over to someone you're all familiar with by now, my emergency management coordinator, who's doing a fantastic job on behalf of the city of Dallas, Mr. Rocky Vaz, to tell us a little bit more about the specific operations of this site. Rocky?
Thank you, Mayor. First, my thanks to Potter's House. We have been working with them for the last 3 weeks to make sure that everything was in place. And thank you to Potter's House again for working with us to make this beautiful site available to us. As you can see, one of the things we are looking for was moving out of K. Bailey Hutchison. As things are opening up, our convention business needs to be opened up too. Keeping that in mind, we have been scouting for places all over the city. This was one of the sites that we are standing up now, and there might be other sites in the future as we start getting more vaccines. So this site, starting today, for the next 3 days, we'll be doing about 1,000 shots per day. And this is by registration only. We still ask everyone to go register at Dallas County website, and we pull the names from there that meet the requirement, 1A, 1B, or other data analysis that PCCI does based on poverty levels, proximity to COVID, our community healthcare analysis. Based on that, we'll be pulling that. We fully expect this site to be operational again next week with additional doses that we are receiving from the state. One thing I want to make sure that, K. Bailey Hutchison site is not shutting down right now. There's been some confusion where people wanting to come here for the second doses. Please do not. K. Bailey Hutchison site will operate and complete all the second doses. If you have been waiting on your second dose, you will be getting notification either this week or next week based on your 21 or 28-day Moderna or Pfizer vaccine. So that'll continue this site starting with a clean slate, first shots, and then we'll continue first shots until we get to the second shot, and that'll continue here. I would now invite AMR to make some comments on their operation, and then we'll go from there. Thanks.
Thank you, Rocky. Thank you, Mayor, for your pointed and inspirational words this morning. Good morning. My name is Will Hinden. I'm the Regional Director for American Medical Response in Dallas and North Texas. American Medical Response is proud to have provided non-emergency medical transport in the city of Dallas for more than 40 years. And all that time, never have we experienced a year like the one we just completed. Everyone has made changes in their lives, some small, some big. That applies to us also at AMR. We have made significant changes in the past year, one of which is helping protect the communities we serve by supporting vaccine administration. That looks different in every community. Just west of here in Arlington, our teams began operating a site with our partners at Arlington Fire Department in late December. Last week, we began supporting a new effort at Globe Life Field operated by FEMA and state partners. We have supported unique vaccination operations in Florida, Colorado, and other states. And now, today, we're excited to be the proud partner of the City of Dallas and the Potter's House to open this vaccine site for the COVID-19 vaccination. Over the past few days, as we've been setting up the site, citizens have stopped in to ask questions, to get help, whether it was registering or preparing for the coming days. These tents behind me and these vaccines that will be administered today represent hope for our city. We've all lived through a year unlike any other in human history, and now AMR is a proud partner of the City of Dallas and the Potter's House to take this next step towards recovery for the City of Dallas. We appreciate the opportunity to serve.
Everyone need, I'm sorry, could you give, do you need his name, spelling, and title?
Yes.
Okay, would you come up and just give me the spelling of your name and your title, please?
Will Hinden, Willhendon, Regional Director, American Medical Response, Dallas and North Texas.
All right, with that, we'll take questions.
Can you say around how many,
Yeah, and then Devon.
around how many people are going to be coming in on any given day?
Is anyone streaming? I'm guessing. Yeah. The question is, how many people are going to be coming in on any given day? I mean, it's 1,000 shots per day. So, Devon.
When the city's factoring in opening up or scouting new hubs for distribution, one of the things I'm constantly hearing is transportation continues to be one of the factors that is hindering some people from getting to the hubs. How much of a factor is that for the city? How much are they weighing in on that?
Okay, the question was about how much of a factor the continuing transportation problems, people's mobility getting to the vaccination sites. Rocky, you want to take that?
That is certainly being considered every time we look at a new site. So we're looking at a mix of where people can go and get a shot, walk in. We have the Fair Park facility that people can take the light rail or the bus. And then, we had a lot of requests for people wanting to come to a drive-through site. Over 95% people wanted to come through a drive-through site for their own safety. They felt better about not having to park their vehicles and then walk and wait in line. So we're looking at those factors. As we expand, we'll look for more sites that are easily accessible through public transportation.
And Rocky, if I could follow up, is the city looking at partnering with Dallas ISD to use any of its facilities, neighborhood sites?
As more vaccines become available, we'll be looking at neighborhood sites. Right now, our allocation is to operate a hub site. We are not allowed to go into communities with the allocations that we have. As that increases, we have every intention to go into neighborhoods and set up maybe about our rec centers, our schools, or libraries, things like that. We're looking at all of those options.
Mr. Rocky, let me ask you a question with the governor and the state announcing that we can now do the teachers. How is that going to work? Are they being put in the front of the line, or do they have to still register and fall according to the order that other people have registered?
Okay, the question is about what happens with the announcement that teachers are going to be a priority group. Rocky.
So the announcement was just made last week. I have a meeting in about 30 minutes with Dr. Phil Wong, our medical authority, to talk about how they're going to accept those names into the county database, if there's going to be a separate database for teachers and school bus drivers and the other categories that the governor, or DISHs, I would say, approved last night. So yet to work out the details on that.
Mr. Boss, I know you're looking at outside vendors to free up firefighters who have been working at the vaccination hub. Where are we at right now? Are those firefighters at Table and Hutchinson be able to move back immediately once they wrap up there? Or where are we with that process?
Okay, so the question is, obviously we have AMR here doing the shots here. The question is, what will happen to Dallas Fire Rescue paramedics who are doing the shots now?
So this site is being operated by a third-party vendor, AMR. We did a bid solicitation in late January. We received many offers. We went through the process, selected the best that we could have to do this. So the firefighters that are at K. Bailey Hutchison, they're only finishing the second shots. So they have 2 days next week and 2 more days the week of March 22nd. In between that, they will be going back to their regular duties. But as we get more vaccines, we might have to engage them back depending on how many vaccines we get and the capability and capacity of vendors. We are looking at additional vendors as this thing grows. So we're looking at all those options.
All right. Any over here? Well, hold on. Everton, go ahead.
Everton Bale with the Dallas Morning News.
Yep.
Rocky said in the past, and data has showed that it doesn't matter where the vaccination sites are happening, equitable access to the vaccines aren't following. So what else is the city doing to make sure that there is equitable access to the vaccine, even though you can't target zip codes?
So the question is, just because the site's here doesn't necessarily mean that a surrounding neighborhood can get it. So how do we ensure equitable access? Rocky.
So again, we are working through a Dallas County registration website that is then, we have several lenses that PCCI, Parkland Center for Clinical Innovation, puts on that. They look at the poverty index, they look at the proximity, they look at the community healthcare needs assessment. And when you apply all those filters, people that need the vaccines the most rise up. And we have done that. We start off with the 75 plus, then the 70, then the 65. Now we are also targeting with the FEMA site at Fair Park, 17 zip codes. And that's 63,000 people within those zip codes in the first 3 weeks that are being vaccinated. We are doing targeted registration on those in those areas. In fact, day before yesterday, we did robocalls to all those people within those zip codes, encouraging them to go register on the site. It's critical that people register because you cannot walk into a hub and get vaccinated if you're not registered and you're not invited to come in to get vaccinated. So people within those zip codes, if they register, they're pretty much guaranteed to get a shot within the week, within next week. So we are asking people to do that. And as vaccines, supply increases, that's going to be more widespread. And we have talked about this many times, just like testing. Today you can walk in and get a test in 5 minutes at over 100 locations. And we hope that that's where we will be with vaccinations the next 4 to 6 weeks, where we'll have community-based and widespread vaccinations available.
If I could follow up, maybe I'll be more specific with my question. lag behind white residents in terms of getting the vaccine. What specifically is the city doing to make sure residents of color are able to get the vaccine at higher rates?
So one thing I want to append to what Rocky just said too is if you register and you're eligible, you can get a vaccine within a week. You don't just expect to register, you or I, and be able to get one necessarily if you're not eligible. So the question is, what specifically is the city doing to try to get more people in these underserved zip codes access to the vaccine? Is that right? Underserved? Yeah.
So we have been working on this for the last 4 weeks. We set up registration hubs in many areas where people of color and the zip codes that we are now targeting, we are encouraging people to get registered, and we are seeing those numbers increase. So the data that you're seeing, there's a lag between when they registered, when they got vaccinated, goes into the state system, and we get the data back. But we are seeing at our Fair Park site more people of color, Hispanic, Latinos that are getting vaccinated. We still have some registration hubs going on this weekend in Council District 8, Council District 7, where most of these zip codes are. And again, we encourage people to register. We have been reaching out to our faith community, have reached out to the Catholic Diocese. They are promoting, asking people to go register, especially people in those zip codes where we know there's the highest concentration of people of color and Hispanic, Latino origin. So we are doing everything we can, and we ask our partners in the media to amplify that message that please register, and if you're eligible, you will get vaccinated quickly.
Question for Mayor Johnson, pertaining to the mask mandate. In light of that, what kind of enforcement will there be in city buildings, in city facilities for a mask mandate?
So the questions for the mayor, it's what kind of enforcement will there be for the mask mandate in city-owned buildings?
Again, I'm step back. I'm gonna take off my mask so you can hear me better. Sorry, I was trying to keep everybody safe here. So my intention, and you have to remember, we have a city attorney that has to, look at the governor's executive order very carefully to make sure that I'm not breaking the law and violating the governor's order. His order trumps all as it relates to an emergency, as long as we're under a state of emergency. So lawyers, as we speak right now, are looking at that executive order and helping us draft an order that will be appropriate. But my intention is to require the wearing of masks on city-owned properties indoors for everybody's safety. Because here's where I think we are at this point. And then I'm going to answer your question about enforcement specifically, but this is all kind of connected. The way I interpret the governor's executive order, we're at a point now where we are no longer going to have the mandate of the state behind us to impel people to wear masks indoors anywhere in Texas. So that is going to leave the private sector, i.e. the business community, and those of us in local government, to the extent that the executive order allows it, to require people to wear masks until we get to the point where it's actually safe not to do so. I've not seen any information, that suggests we're at a point with vaccination rates to where we should be lifting any mask orders. But that happened above my pay grade, so I have to do what I can do at my pay grade. My pay grade says we think that I can mandate it at city facilities, which is my intention. Businesses, to my understanding, and again, attorneys are looking at this right now, it's my understanding that businesses can also require it in their businesses. That's why I've been on social media leaning on our regional chamber and other businesses and praising businesses, supermarkets, you name it, that are continuing to keep their protocols in place. The Mavericks and the Stars have said they are not changing anything about their protocols for attending their games. You got Kroger and other supermarkets are saying that they're going to keep doing what they've been doing with requiring masks. You have some that are not. I'm not happy about that. I'm not going to lie to you. I want to see the private sector and local government do everything they can to step up to fill that gap that's been created by the removal of the state order. Enforcement is something that our city attorney will have to tell us is possible and how, because the way our emergency laws work, essentially an order of mine takes on the effect of a city ordinance. It takes on the power of a city ordinance in an emergency. So we'll have to look and see what all that means. But that is my intention, and that's the fullest answer I can give you at this point while the attorneys are looking into it.
Mayor, can I ask you? Hold on, we got a question in the back here.
Is the mayor see coming the governor's mandate lifting everything?
Did the mayor see coming? Did the mayor see that? I mean, he's not psychic, but I'll let him.
I am psychic. No, I did not. I don't know who was consulted in advance of that announcement, but I was not one of those people.
Mayor, there's residents of Dallas who are hearing one thing from their governor and hearing a different thing from you and other local leaders as well. Why do you think there is such discord between the state and local governments on this mask issue? Is it politics at the governor's level?
The question is, why is there so much divide between what local officials are saying and what the state government's saying, and whether it's political?
I'm going to try to answer that question as robustly, honestly, thoroughly as I can without boring you all to death. I don't know. If anything, I don't know what the governor has seen or is looking at in terms of science or data that would have suggested that this was a good time to lift that mandate, the mask mandate. I honestly don't know. I've not heard him explain. We have not talked about, since the announcement, why he felt now was a good time to do this. My personal opinion is I believe that based on what I've read and what I've seen and what I've heard from the CDC and from medical professionals, that we are nowhere near the level of vaccination that we need to be considering stopping doing something that has proven to be very effective in slowing the spread of the disease. So I don't know. I wouldn't describe it as there's all this disconnect or discord between the different levels of government. This is not a political infighting problem. We're not fighting. The governor and I aren't fighting. I can't speak for other people, but I'm the mayor of the city of Dallas. My job is to protect my residents. That's what I try to do every single day. And that means it makes sense for me at every opportunity to partner with the governor of the state of Texas. And I try to do that. I try to keep the line of communication open. I try to work with the governor's office every chance I get, because that partnership benefits the residents of Dallas. I don't care about any partisan political issues or anything like that. I'm a nonpartisan elected mayor, and I have a job to do. So I have no idea about political infighting. I just know that I have not seen anything in the data or any science that suggests that now was a good time to do what he did. So you'd have to ask the governor what he saw or what he heard or who told him this was a good time to do this, but it's not consistent with anything I've seen or that I've heard. That's all I can tell you.
Mayor, I was going to ask you, are you worried about a possible spike coming now that spring breaks around the corner?
Well, I think we're all, everybody up here, has been dealing with this literally day in, day out since February of last year, So, yeah, we're concerned about spring break. We're concerned about the message that some people may have taken from the governor's announcement that, that we don't need the masks anymore. We're concerned about the lack of speed in getting more vaccines to our community to distribute. We're concerned about all of it. Like I think all of those things combined are a situation that need to be monitored and addressed. So yeah, we are doing everything we can to get vaccines that we get out as quickly as we can, but we need more. In light of the governor's announcement, we're doing everything we can here locally to tell people they need to wear a mask anyway. We're trying to combat any perception that people may have taken from that announcement that they don't need to wear these masks anymore. We believe that they do. So that's really the situation that we're in. I mean, yes, spring break is an issue, but so is the announcement and so is the lack of vaccines. It's all a challenge. But we're having to just do what we've been doing for the past year, which is meet challenges. And that's what we're going to do.
We'll do one more. About the vaccine, if you're able to do 1,000 here a day, would there be a potential for next week adding more vaccinations here, or would you only be looking into going to other locations?
The question was, are we going to be continuing vaccination here next week, or are we going to move to another location? At this point, no. Since the vaccination allocation is a very small number, we only had 3,000 this week. I was just told minutes ago that we got allocation of another 3,000 for next week. So we'll continue Thursday, Friday, Saturday, 1,000 a day this week, and pick it up again next week, Thursday, Friday, Saturday, 1,000 a day.
Back here, or would you
Here.
And I'll add, the AMR has the capacity to do more than 3,000 a week, but that's the allocation that we've got. So with that, Everton, I know you had one more. Go ahead, and we'll close it out after that.
I just had a couple of quick points for clarification.
Yeah.
Mayor Johnson, your order, it's right now it's being drafted, right? You're trying to implement it before the governor's order takes effect next week. Is that correct?
Yeah. Yes, it's being drafted right now, and it would take effect, after Wednesday. Currently, you still have to wear masks at city facilities through the governor's current order. After that order will pick up.
Okay. And then, what type of vaccines are being distributed here?
Moderna.
And then, has the city asked for Johnson & Johnson vaccine?
Yes, we have.
Okay.
Yeah.
Any ideas?
So-
We haven't gotten a response.
The city has asked for Johnson & Johnson vaccines to answer, as Rocky just said, but we haven't gotten a response. So with that, thank you all very much. I'll stick around for a few minutes if there's any other clerical questions like that. But thank you all for coming.